You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says that for some people, especially those that don't like their smile, that an improved smile can absolutely change your life, especially if you don't like your smile. And so we've invited New Jersey's go-to cosmetic dentist on the program today, Dr. Konstantine Trichas. Dr. Trichas, welcome to the program.
Thank you, Randy. Pleasure to be here.
Now, you've developed, I guess, quite a reputation in Jersey. This is like the go-to guy for cosmetic dentistry.
Well, we've worked hard at developing that title, and it's something we enjoy doing.
So who's the typical cosmetic dentistry patient these days?
You know, Randy, we don't have a typical patient. So a typical patient can be anybody who wants a beautiful smile. It could be the 30-year-old who's getting married. It could be the 20-year-old who's graduating from college. It could be the 70-year-old who's widowed.
70-year-olds are doing it?
70-year-old
like veneers?
70-year-old who's widowed and wants a new start in life. It can be anybody who wants a beautiful smile. Why not?
Now, you're setter, and we're talking about cosmetic dentistry and veneers today, but I guess you have this concept of you pretty much do everything under one roof. Elaborate.
Absolutely, Randy. In our office, we perform all the most procedures. We perform root canals, Invisalign, makeovers, implants. So everything's done in one house, essentially, and patients love that fact that they can come to one location and not be essentially sent all over town to get their work done.
So is cosmetic dentistry more art or more science? Or a combination of both, I guess?
Randy, cosmetic dentistry is definitely a combination of both. Of course it's art. It's you either have it or you don't. It's very much an artistic discipline, and I've gone all over the country to learn from some of the, I've had mentors, I've studied countless hours to be able to provide this type of service to my patients.
Because it's not a recognized specialty like a cosmetic dentist, but I guess probably even 10% of dentists or less than that, or even guys that have committed to, because this is your focus, right?
Cosmetic smile design is what I focus in on, and that is the blueprint that we as cosmetic dentists use to provide beautiful, natural smiles.
And I wanted to ask you this because knowing you're coming here, that I feel like I could spot big giant veneers walking down the street from 20 yards. Is it the patients want this big teeth look, or is it the doctor maybe that didn't do it right? I mean, you tell me, because I know you want to be positive about other dentists.
Yeah, I mean, the reality is the patient does not want that, and that what a patient wants is a natural smile, and unfortunately, a doctor has to start somewhere. So maybe during they're starting their cosmetic career, they have to build years and years of clinical skills and creating a process that allows for the transformation to be natural.
Now you say it's like for some people it's life-changing.
Yeah.
Is that an overstatement?
Oh no, absolutely not. It's transformational, Randy. It's been holding them back for 20 years, and now you're unleashing them, and for the first time they're able to learn how to smile, and they've been holding back so long that the ability to smile again takes some time, but they are transformed.
What do you mean it takes some time?
They've been hiding that smile, so they go. There's stepping stones to learning how to smile naturally. They go from a forced smile to a guarded smile to like busting loose and letting their personality out. I mean, that takes time. You've been holding back for 20 years. Do you think you could just literally turn that loose in a matter of 2 hours? It takes time.
Are there that many people that don't like their smile?
Oh, absolutely.
Like, is it all over the place? I mean, you hear it all the time, I guess.
Anecdotal stories. I go get my cup of coffee in the morning. I go to Starbucks, barista. I crack a joke. I make her laugh. What does she do? She hides her smile with her hand. So by seeing that barista, Randy, I can change her life. I can make her smile again. I can make her, refrain from hiding her smile. So,
you don't give her a card, though.
I don't, but I'd love to. I'd love to be able to change, one smile at a time. I mean, that's my passion. So
you, as a dentist, you walk around, or you're in Jersey, and you could tell who's hiding their smile.
Oh, absolutely. I mean, I can tell within a millisecond what's going on. So it's a shame, but there are endless transformations that can take place.
You know, now we were in the green room. You showed me some of these photos, and these are somewhat dramatic. So what are we looking at over here? You brought some photos.
Oh yeah, I brought some photos. So what I have here are some transformations that I'd like to share with you. What we have here is Anthony. He has a super dynamic guy, but he has a problem. He has worn teeth. They're flat. They age him prematurely. He's got black holes near the corner of his mouth.
All right.
And essentially, what does he want? He told me he wants John Travolta back. What does that mean? He wants a youthful smile. He was a handsome guy. He showed me a picture of himself at 35. This guy was unbelievably good looking.
So what do you see, like when you, as a cosmetic dentist, when you're looking at this guy's, what do you see?
I see potential. I want to take this guy and essentially make him more youthful. Give him back what he lost.
Okay.
He lost his youth by grinding his teeth, and we are going to give him back his youth and give him back that beautiful smile that he desires.
So what did you do?
Boy, I mean, we gave this guy, we gave him back his youth. I mean, we did a full mouth reconstruction. We gave him veneers, crowns, implants, but we were able to lengthen his teeth, widen his smile, fill in those dark holes, and give him back his John Travolta, his youthful look.
Let's take a look.
Oh, absolutely. Does this man look younger? Look at the before and after. He looks
a little younger.
Looks younger. He looks thinner. He looks happier. He is smiling. He's conveying energy. He's got John Travolta back. When I met this man, he came in and he essentially said, look, I have a bucket list. One of them is a beautiful smile. I got my Ferrari. Look outside the window. You can see it. I want a beautiful smile. I want John Travolta back. He went to 5 other dentists. We did this test drive or this reveal. He loved it. His wife loved it, but his wife forced him to go to 5 other dentists to get second opinions.
Okay.
He circled back after visiting every single dentist and he said, look, I love you, Dr. T. He did. And I knew it. I knew he loved me.
Like you just had a good connection.
Yeah, we had a good connection. So I knew, I was in the running. But he said one thing, and he was concerned. He said, everyone says you cannot do this. So I said,
can't do what?
Can't do the smile design without Invisalign braces, a year of braces, or removing teeth. And I said to him, Anthony, we used smile design. We already did the analysis. I did my due diligence. I proved it. I showed you in your mouth. What will it take to prove that I can do this case? And I said, wait a minute. You know what? If I can take your cast on your model with the crooked teeth and in 30 seconds show you that I can straighten them without removing anything, will you believe me?
Okay.
So I grabbed my high speed. I prepped the teeth, perfect alignment. He reached out, shook my hand, and he said, kid, you got the job. And from there, I was able to transform him. He's become one of my good friends.
Good.
And great story.
Now, smile design. You call it smile design.
Yeah.
Like take me through that process, a short version of that process.
Yeah, so smile design is the blueprint that we as cosmetic dentists use to create beautiful, natural smiles. So one of the greatest compliments that you can get from a prospective patient is that everybody loves my new smile and they want to know what I did. So that is, no one should know that you had a transformation. So, smile design is the blueprint, and what makes each smile unique is we use your own facial analytics to create that smile. Every smile should look unique and not off the shelf. So we use your facial analytics to create your smile, and it is a blueprint unique to you.
Now you say that women have different veneers than a man. Like the shape. Like,
sure.
What do you mean by that?
So women have different shape and sizes than men. Women have, essentially could have curved, they're more curvy on the incisal edges, and you can feminize somebody or you can masculinize somebody by creating straight edges. So essentially, we look at your face, we create that incisal edge by looking at your pupils. We create that midline that is specific to, the midline of your philtrum, your glabella. We use these landmarks to create something that is unique to you and fits your face. Here's a guy who came to see us. He didn't know, what he liked. He just liked to smile. He didn't know how to smile. So essentially, he came to me and said, Doc, is this the worst smile you've ever seen?
They'll say that?
They will say that. A lot of these people have, they've lost their confidence in their ability to smile. He said to me, Doc, I just want to smile again. What is that you can do? And I said, I looked at him and I immediately knew, I was able to visualize the final product, and I knew I could help him. And I said, you know what we're going to do? We're going to give you a beautiful smile. We're going to make your gums healthy. We're going to fix your broken teeth. We're going to give you some veneers, some crowns, some implants, and we'll give you that ability to smile again. After, this is what he looks like after we were done.
Wow, looks good.
So this is what we were able to provide for this man. And as you see, he is smiling, but he hasn't let loose yet. So he is.
What do you mean let loose?
You know what? After he's still guarded in his smile. He hasn't smiled in 20 years.
So he's not like smiling big.
He's not smiling big. That's a forced smile. He's learning how to smile. But 10, 20 more compliments, and he'll be letting them loose. In fact, anecdotally, when he's coming in now, he's smiling. He's wearing beautiful shirts. He's scented. He's a new man. Put these side by side. What do you see? Do you see somebody who appears more happy? Does he appear more confident? Does he appear more educated? The fact is, this applies to everyone. Of course, that's what a smile can do for you.
He's definitely more handsome in the after.
Absolutely. He's a more confident, more handsome individual.
When they look in the mirror for that first time, are they kind of blown away? Like, what do they say?
Absolutely. I mean, they're blown away. This is why they came here. They came here to, have the ability to smile again.
I don't miss this. I don't want to see this picture. So since I've been coming here, I've had a full mouth reconstruction. So far I've had gum recontouring, over 8 extractions. I've had all implants put in on the top and bottom of my mouth. I think the defining moment when I realized that I needed all this work done was honestly just the pain I was in, and the fact that I was so young and I was gonna be getting married and I didn't want to walk down the aisle or have all those professional pictures taken with such a gross smile. And I think that was the turning point when I said, okay, I need to get an entire mouth reconstruction before I get married. When I first saw my teeth after having my entire life of such horrible teeth and that horrible insecurity, I remember looking in the mirror and just breaking down crying. Like it was surreal. It didn't look like me, it didn't feel like me. There's no words. Because that is what I have wanted my entire life. And I finally had it. I smile every chance I get, and I have never had that. And I am so happy that I now have it. I owe Dr. T everything. Not only did he give me the confidence to smile and the confidence to be that bubbly, outgoing person I am, but my fiance and I invited Dr. T to our wedding. And you don't get that in a normal dentist. And I am forever grateful for how talented and how just genuine he is.
So here's another patient. This is Ava. She came to me on her birthday. She came to us on her birthday, sent by her mother, requesting that she get a new smile because she had learned to stop smiling.
Okay.
And she was, as a child, she smiled all the time, and as an adult, she stopped smiling. So what do I see? I see a beautiful person with a smile that does not suit her personality. You look at her teeth, she has dark teeth, short teeth, dark spaces, and essentially I knew that this smile did not suit her personality. We were able to transform her and give her a smile that suited her personality.
Okay.
And you can see what we were able to do for her. If you look at that,
very nice.
When you put these pictures together, what do you see? You see a more vibrant, happier, youthful individual.
Yeah.
And now we're able to capture her true personality. She's smiling again, and she's a happier individual.
Now, some of these transformations are done very quickly, right? Like you could come in on a Monday and get it done on Friday. Get the new teeth.
She came in and she left with that beautiful smile after the last appointment. She walked out with that beautiful smile.
Now, when you see them on the follow-ups, you say that you see personality changes?
Oh, absolutely.
You don't even recognize them sometimes?
I don't recognize them. This is a brand new individual. She comes in, she's smiling, she's greeting everybody, she's transformed, smiles, hugs, new person. Here's another picture.
All right.
We have an individual here that stopped smiling. She had an amazing personality. She had tetracycline staining. As a child, her teeth were not responding to whitening, and she wanted a solution. Essentially, she came to us, and we were able to give her that youthful smile.
So what'd you do?
You look at her teeth. We were able to give her veneers, and we were able to broaden her smile, fill in the corners, widen her smile, whiten her teeth, and this is what we were able to accomplish. And if you look at these pictures before and after, this is a patient who didn't like her smile for 20 years. And now we've given her the ability to smile. And think about the lost years. For 20 years, this is a patient.
Good point.
20 years she lost. She wasn't able to smile. 20 years of lost time.
Those are the good years, the younger years.
Absolutely. She could have been smiling 20 years ago.
Well, see, nobody likes going to the dentist, right? I mean, you must hear that every once in a while. Like, no offense, doctor.
Yeah, I hear that all the time, but everybody comes in and says, Doc, I don't like being here. But the reality is we are able to make them feel at home. And over the course of time, we're able to change that perception and make them feel like they are at home and comfortable.
Is this one of those things where they say, I should have done this years ago? Like they're kicking themselves.
Absolutely. I mean, you think about the lost time. You stop smiling for 20 years of your life. And you can't get that 20 years back. And we're able to.
And one afternoon, the whole thing's changed.
And in one afternoon, we're able to transform them, and it's a new person.
So you're a dentist, cosmetic dentist. So you probably think the smile is like the most important thing. How important is it?
Yes, it's not just me. It's everyone. I mean, Hollywood, they want to make somebody look poor. They just give them dark, dingy teeth. On a job interview, you got two twin sisters, one smiling, one's not smiling. Who's perceived as more likable?
You don't probably hire the person with the better smile, but if one is smiling, one isn't, you hire the one that looks happy or enthusiastic or.
The perception is that that's a happier individual. Yeah, even as a dentist, I've seen what a transformation can do. Even just as simple as recontouring a canine, these people come back with more energy. They're dressed better. It's a completely different individual. Even as a dentist, I'm surprised at the transformation, the behavioral transformation.
Because I think it's just teeth, right? Like going into this, and I told you, well, it's just teeth. Because I always think you guys are exaggerating. Yeah. But when you look at some of these before and afters, it is dramatic. I mean, it changes their appearance, but I guess they feel better about themselves.
Absolutely.
So they're going to act differently.
Absolutely. The behavioral transformation is evident from the get-go. I mean, this is a different individual. Their personality changes, the way they dress, their hair, their energy, it's completely different. They're born again.
Is there a huge learning curve, like Dr. Trichas 20 years ago and Dr. Trichas today? Yeah. Have you gotten that much better?
Absolutely. There's a learning curve for sure, but what we've done is refine the process.
Okay.
We've created a process that is tried and true, and essentially sticking to that process allows us to deliver every time. Essentially, as a young man, I remember going home one day and saying, "Oh my God, I have like 20 makeovers in process. I mean, what if?" But that never happens anymore. Essentially, I've gone through the process. We've created a system that works. We've transformed thousands of smile, and if we stick to that process, we're able to create beautiful, natural smiles every time. We have another patient here.
Pretty good smile.
But she didn't like it. So essentially, she didn't like the color, she didn't like the gold, she didn't like the shape, she didn't like the fact that she was young and didn't portray her youth when she smiled. Look what I was able to do for her. Look what we were able to accomplish. So what you see here now is a more youthful, more confident, more feminine individual. This person has what she was craving for 20 years. This is why she came to us. Let me show you this guy.
All right.
So we got Frank.
Wow.
Frank was sent to us by his wife.
This has got to be unusual.
It's not unusual. This person's lost the ability to smile. It's very common. So this is an easy fix for us. Essentially, we can make this person smile again. It's very common at home. There's many people sitting there watching this right now that have lost the ability to smile. His wife sent him in. His wife wanted to, essentially help transform his smile, make him smile, help him eat properly. He was having troubles eating, and he was sent to us by his wife. And so this is what we were able to do for Frank.
Very nice.
Absolutely. Look at the before and after. Does he look happier? For sure. He's a different individual. He's got, his wife is happier. He's smiling more. He's eating better. He's more confident with his grandchildren. He's more confident in public. Different man.
Nice.
He's enjoying his meals as well. Big difference.
We have time for a few more.
Here's another one, Randy. Another individual who lost his ability to smile, wanted a more youthful look. Very successful human being, essentially wanted a smile to suit his personality. Again, sent to us by a girlfriend.
Okay.
And the girlfriend told him, just pure out, you're a good looking guy, but I want you to be able to smile again. So he came to us and was searching a solution for a more youthful, attractive smile. And take a look at what we were able to do for him.
Wow.
So this is an individual who is successful, has patents, is incredibly intelligent, and wanted a look that essentially suited his personality. Now this is a guy who's happier, has a successful personal life. Let me show you this next patient. Here's a patient who came in who didn't like her smile. You look at her smile, discolored teeth, dark teeth, very unhappy. I look at it and I can tell her immediately, I can transform her and give her a beautiful smile.
Okay.
And this is what we were able to do for her. This is dramatic. This is beautiful. This is exactly what she wanted, and it suits her personality. Now,
looks good.
We were able to transform her smile. We used porcelain veneers. Look at these veneers. They look unnatural.
They look natural. Yeah.
This is natural, and as a result, this is a happier individual. Here's another one that we were able to transform. This is someone who basically disliked her smile since she was a young child, since she was 10 years old. She was bullied as a child and wanted us to transform her smile. She came to us, didn't like anything about her smile. So this is what we were able to accomplish for her. You look at that photo side by side. This is obviously an individual who is happier, and these are veneers. We were able to use veneers, some crowns, but you look at these teeth, they look natural. And for that, she is grateful, and it's transformed her personality.
Insurance obviously doesn't cover this, dental insurance, but is this one of those things some people are financing?
Absolutely. We're able to give somebody a beautiful smile, and we can finance it for as little as a couple $100s a month.
So people do finance this?
Absolutely.
So you're not carrying it yourself, but they have to have decent credit, make some payments?
Absolutely. They're coming in, and they are happy that we're able to provide financing, and for as little as a couple $100s, they're able to have...
They get a whole smile makeover.
They could have the smile that they've been dreaming of all their life. Do we have time for a couple more?
Yeah.
Okay, take a look at this one. Essentially, this is a woman that was very unhappy with her smile, had been bullied all her life. Bullied, that's the word.
Over her teeth?
Over her teeth. She was bullied at the color and picked on. And you would never know it. She's a successful individual, but she lost the ability to smile. And look what we were able to
Wow.
accomplish for her.
Wow.
Essentially, through veneers and crowns, we were able to transform her smile. The beauty of this smile, we took our time, and when she was able to test drive the temporaries and essentially say, Dr. T, this is the set of temporaries that I like. We gave her a few set of temporaries.
So they get like an initial smile, so they could look at what it's going to look like first. Once they approve it, then the porcelains come in.
So
is that kind of how it works?
They get a set of temporaries that mimic what the finals are supposed to look like.
Okay.
And essentially, you want your patient to approve the temporaries because they mimic the size, shape, and almost color of the final products. So we took our time with her. We let her have a set of 2 or 3 temporaries before she chose the smile that she liked. After a set of 2 or 3 temporaries, she was extremely happy with what she saw, and that is the final result.
Looks good.
Would you say that's a different individual?
Yeah, it looks different. It's very nice.
And here's another smile that we were able to transform. This is an individual who came in missing teeth. Essentially had lost her confidence. So with her, what did we do? We gave her, some veneers, some crowns, and
let's take a look.
And here's what we were able to accomplish. So take a look at that. A different individual. Side by side, look at the pictures. Big difference with her. Another picture here.
Now that looks like pretty good teeth.
They are pretty good teeth. Discolored, unhappy about the color, had some bonding done 15, 20 years ago, wanted that bonding. Once you've had bonding, unfortunately, the bonding soaks up stain, it soaks up every coffee, every glass of wine you had, and this is what we were able to do for her.
Very nice.
Side by side, you look at this individual, what do you see? You see a happier, more confident individual.
Yeah.
This person is a successful individual. Now we were able to give her the look that she deserved.
So you're of the, and we're out of time, but you're of the opinion, look, cosmetic dentistry is not for everybody.
Yeah.
And if you don't like your smile, do something about it.
Absolutely.
Is that it?
Absolutely. If anybody out there who's watching, if you're unhappy with your smile, you have the ability to do something about it.
Final message, somebody watching this, they've seen the photos,
Yeah.
they don't like their smile, but for whatever reason, they're still skeptical, or they can't get themselves to just do it. What do you say to them?
We invite them in. We tell them what we can do for them. Look, if you don't like your smile, there's something you can do about it. That's it in a nutshell. So,
all right, good. Well, I want to thank you for coming on the show. And you've got lots of photos on your website.
Yeah.
They could go there.
Yeah.
And do they get to see you on the consult?
Absolutely.
Okay,
Absolutely.
good. All right.
Yeah.
New Jersey's cosmetic dentist. I want to thank you again.
Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.